everyone, Dr. Chris here. Welcome back to the channel where we mix medicine with a healthy dose of adrenaline. As an orthopedic surgeon, I spend a lot of my time fixing broken bones, torn ligaments, and shattered dreams. And let me tell you, there's never a dull moment, especially when it comes to extreme sports injuries. So today, we're diving into the wild world of extreme sports to look at how these athletes push the limits of human performance and sometimes, well, pay the price. Extreme sports are all about pushing boundaries. Whether it's jumping off cliffs with a wingsuit, riding skyscraper-sized waves, or snowboarding down mountains at breakneck speeds, these athletes are constantly testing what the human body can handle. But why do they do it? Why would anyone willingly throw themselves in the face of danger this way?
Play the game, you take the pain, you know the dangers, and you're willing to pay for them to do what you love doing.
For many, it's about freedom and self-expression. Extreme sports offer a sense of accomplishment and a way to stand out, while also fostering a strong community. One where people bond over the shared love of testing limits and challenging themselves in ways most wouldn't even consider.
There's almost nothing in the world I've experienced with more energy. You feel it set in, it's almost like a click, and everything is calm. Everybody lands knowing we got it.
I'm high in my life right now, there's nothing like it.
Holy moly! Do you think they can go any faster than me?
I think it's safe to say these thrill seekers are in it for just that. The thrill, the rush, and the feeling of being alive. But there is science behind that. When that adrenaline hits, your body releases hormones like adrenaline and cortisol, which boost your heart rate, tighten your muscles, and make you feel supercharged, all to help you react faster and push your limits.
There's always that one glance down inside of the corner of your eye, because once you make the turn and look, you're like, oh man, I am high.
The thrill also triggers a massive release of dopamine, the feel-good chemical in your brain that makes you feel joy and excitement. But here's the kicker. Once you experience that rush, you want more. That's why extreme athletes keep coming back for more, pushing themselves to greater risks. And just like exposure therapy, the more they do it, the less reactive their cortisol, the stress hormone, becomes, letting them enjoy the dopamine without so much of the fight or flight physical reaction, so that they can actually stay calm under pressure.
They don't get this big buzz off of this experience like you might think. They feel really calm and focused. They have a flow state.
In fact, many extreme athletes report that these sports provide a way to cope with stress, anxiety, or even personal trauma. For others, it serves as an escape from the ordinary, a chance to feel alive in a way that day-to-day life just doesn't provide. But let's be real. When you're flying through the air or plunging into a wave at 40 miles per hour, the risks are sky high. According to recent studies, participation in extreme sports is on the rise globally, especially among younger generations. And with more people taking up these high-risk activities, injuries are becoming more common and more severe.
I mean, I had to relearn how to walk and talk, and I had to learn how to swallow again, and I had to learn everything from the start.
Today I'm going to take you through 5 of the most common injuries we see in extreme sports, explain what's happening inside the body when they occur, and talk about how we, as surgeons, fix them. Please note that viewer discretion is advised, as some of these videos contain graphic content. Let's start easy with a classic, the wrist fracture. Picture this. You're a snowboarder hitting a jump. You're in the air feeling like a freaking rock star, and then you lose your balance. Bam! You land hard on your outstretched hand. This kind of fall often results in a Colles fracture. That's a fancy way of saying you've broken the radius bone in your forearm, right near the wrist, with the broken piece tilting backwards, or apex volar dorsal angulation. Ah! Because yeah, it hurts.
You can imagine that with falling in extension, the radius buckles dorsally. So here we can see an example of a Colles fracture.
From an anatomical perspective, your wrist is a complex joint made up of 8 tiny bones and 2 forearm bones, the ulna and the radius.
So the distal radius is this part of the radius bone. The radius is the forearm bone on your thumb side of your arm.
When you fall on an outstretched hand, also known as a fouche injury. All the force travels through the wrist and cracks the radius. Now, why is snowboarding particularly prone to wrist fractures, and why are snowboarders 18 times more likely to break their wrist compared to skiers? Well, unlike skiing, where your hands are often occupied by ski poles, snowboarders tend to use their hands for balance and to break their falls, unfortunately. When they go down, it's a natural reaction to put your hands out to catch yourself, even when falling backwards. Unfortunately, that's often a recipe for disaster. Snowboarders also tend to fall more frequently than skiers, particularly beginners. The sideways stance of a snowboarder makes balance more challenging, increasing the likelihood of falls. Add icy conditions or tricky terrain into the mix, and the chances of landing awkwardly go way up.
And if you know just a couple tips, you can drastically increase the chances that wrecking won't actually hurt you enough to stop shredding.
And fall on your forearms if possible, and that's just gonna brace the landing better than sticking your arms straight out.
According to a study published in the British Journal of Sports Medicine, wrist fractures account for up to 1/4 of all snowboarding injuries. Beginners are especially at risk, with first-time riders being significantly more likely to suffer a wrist injury compared to experienced riders. Wrist guards have been shown to greatly reduce the risk, but many snowboarders still hit the slopes without them. Those dang risk takers!
Any piece of safety gear is gonna help keep you safe.
Interestingly, snowboarders aged under 18 make up the majority of wrist fracture cases. This is partly because younger riders, in their carefree give-a-damn attitude, are more likely to take risks and less likely to wear protective gear. But even the most experienced riders are susceptible to this injury, like when pro snowboarder Katie Ormerod suffered a wrist fracture during a training session for the Pyeongchang Olympics in 2018. We don't have footage of the exact incident, but we do have a video of her from a similar event.
So definitely the rails were her weakness. She could have came off a little bit further on the end.
And thankfully, having seen this common injury so many times before, orthopedic surgeons know just how to handle it. In minor cases like Katie's, no surgery is needed, but for more serious cases, we're looking at a plate and screws to stabilize the bone. In extreme cases, even percutaneous K-wires or an external fixator frame. The challenge? Making sure the wrist regains its full range of motion after fixation. Fellow Canadian orthopedic surgeons Dr. Paul Zalzal and Dr. Brad Weening are about to fill you in on what you can expect.
After 6 weeks of fracture and immobilization, your wrist is going to be stiff and weak. I'm not perfect after 6 weeks, okay? No.
After surgery, patients typically need to wear a cast or a splint for several weeks. Once the cast is removed, physical therapy is essential to regain strength and flexibility in the wrist. Full recovery can take anywhere from 6 to even 12 months, depending on the severity of the fracture.
There's a very real possibility that you'll have some permanent limitations, either subtle loss of strength or loss of terminal range of motion. For example, something called supination, where maybe you just can't get your hand all the way up.
Let's magic school bus ourselves to another part of the body to look at the next extreme sport injury in closer detail.
Felt pretty good, wanted to start going for it, working some new tricks, and unfortunately came off that box a little too early to a flat landing, and boom.
The dreaded ACL tear. Olympic-bound athlete Julia Marino learned about it the hard way. If you're into freestyle skiing, you've probably heard the horror stories about this injury. The ACL, or anterior cruciate ligament, is one of the key stabilizers in your knee. When you twist or land awkwardly, especially with your foot planted and your body turning in the opposite direction, the ACL can snap like a freaking rubber band.
Sports that involve a lot of turning and twisting or planting and pivoting are the sports that people are at highest risk for getting an ACL tear.
Orthopedic surgeon Dr. Martha Murray is exactly right. And freestyle skiing is particularly prone to ACL tears because of the dynamic and unpredictable nature of the sport. Skiers are constantly flying through the air at high speed, flipping around and landing on uneven surfaces, sometimes even only on one leg. Picture a skier attempting a 720-degree spin. They don't quite stick the landing, and their knee twists violently. That's enough to rupture an ACL. Even on more straightforward jumps, skiers are at risk, like what happened with Olympic freestyle skier Lindsey Vonn when she suffered an ACL tear during the 2013 World Championships in Schladming, Austria. She lost balance after a jump, causing her knee to twist unnaturally, and boom! ACL freaking torn, bro. These injuries are one of the most common in skiing, accounting for up to 15% of all skiing injuries. Female athletes are at even higher risk. Studies show that women are 2 to 8 times more likely to suffer an ACL tear compared to men. This is due to several factors, including differences in anatomy, muscle strength, and landing mechanics.
Women in particular, right after their growth spurt, get nice long legs but don't automatically get the muscle mass to support them. And that can be kind of a key window of vulnerability for getting an ACL tear.
To fix a torn ACL, we're talking about reconstructive surgery here. Although some patients can treat an ACL conservatively without surgery, for most people reconstruction is necessary. We usually take a graft from another tendon, historically the hamstring or patellar tendons, but more recently the quadricep tendon, and use that to rebuild the ACL. Recovery can take between 9 to 12 months, and trust me, it's a long road back to the slopes. After ACL surgery, athletes often go through a structured rehabilitation program. This includes exercises to strengthen the quadriceps and hamstrings, improve balance, and regain range of motion. Full recovery can take up to a year, but many athletes will be able to return stronger if they follow their rehab plans diligently. While there are certainly some parts of rehabilitation that can be optimized and expedited, biology isn't really one of them. So at times you just have to let Mother Nature do her thing. But thanks to trainers like Leonidas who take a holistic approach to recovery, athletes are in good hands.
We're doing a lot of exercises that are not just the strengthening in the muscles surrounding the knee, but flexibility and range of motion in the ankle, in the hip.
I think this injury has only motivated me to continue racing longer.
And even though recovery from this injury is possible, prevention is always the best medicine. So here's a pro tip for any skiers who want to reduce your risk of an ACL tear. Strengthen those leg muscles, especially your quads and hamstrings. A little prehab goes a long way. Next on our list of injuries involves one of, if not the, most important structures in the body. While participating in the extreme sport will feature next certainly requires backbone, it's the spine that is one of the first places to get injured.
3, 2, 1.
Base jumping is one of the most extreme sports out there. And when things go wrong, they do really go wrong. A common injury in base jumping accidents is a spinal compression fracture. This happens when you land hard on your feet or buttocks and all that force travels up your spine, crushing one or more vertebrae.
What happens in this type of fracture is that the bone squishes down on itself because the bone is not able to support the weight of the body.
Your spine is made up of 33 vertebrae stacked like building blocks. When you experience a hard impact, the vertebrae can crack or even collapse under the pressure. The most affected areas are usually the lumbar or low back and thoracic mid-back spine. And as experts at Norton Healthcare explain,
a force that's either loaded onto the spine, car accidents, falls, trauma, stuff like that, or it happens with age.
Base jumping is particularly prone to spinal injuries due to the high impact landings and the lack of control during descent. Unlike parachuting, base jumpers have much less time to deploy their parachutes, increasing the risk of hard landings. Studies show that spinal injuries account for about roughly 1/3 of all injuries in base jumping. The mortality rate of base jumping is also alarmingly high, estimated at 1 death per 2,300 jumps, which is significantly higher than with skydiving. But some are willing to take the risk, like base jumper Matt Goff. In 2013, during a jump in Italy, he experienced a parachute malfunction, leading to a hard landing that resulted in multiple injuries, including the spinal compression fractures we've been discussing. The thoracolumbar junction is especially prone to injury during hard impacts because it's where the rigid upper back meets the more flexible lower back. Most lumbar fractures from sports can be treated without surgery using rest, NSAIDs or anti-inflammatories, muscle relaxants, and bracing. However, in more severe cases, vertebroplasty and kyphoplasty are minimally invasive procedures that either stabilize the fracture by injecting bone cement into a vertebrae, or, as in the case of kyphoplasty, inflating a balloon within a vertebrae to restore vertebral height. In the most dramatic cases where pain persists, spinal fusion surgery may be needed to stabilize the spine by connecting multiple vertebrae together. Afterward, patients wear a brace for several weeks and avoid movements like lifting and twisting so the fusion can really do its job. Once the brace comes off, it's crucial to start strengthening the areas around the spine, like the core, hips, thighs, and postural muscles, which helps counteract a common habit after spinal surgery, something physical therapist Dr. Christy Enos points out for us.
Because what tends to happen is this and this, you kind of flexing forward a little bit, just as almost a protective mechanism for that spine.
Full recovery can take anywhere from a few months to up to a year, depending on how severe the injury is. During this time, it's crucial to avoid any further damage, though that may be difficult for these risk takers.
Come on, we've always been risk takers.
Like gravity, another powerful force that these thrill seekers are eager to challenge is the ocean's waves. Surfing is one of the most exciting extreme sports, but it also comes with its share of risks, one of which includes shoulder dislocations. And although people don't often consider shoulder dislocations to be that serious, when they occur in open waters, far from shore, they can become life-threatening and significantly increase the risk of drowning. Professional surfer Leo Fioravanti is just one of many who have had this happen to them. He suffered a shoulder dislocation during a wipeout at the Margaret River Pro in 2019. The powerful wave knocked him off his board and forced his arm into an unnatural position, causing the dislocation. The shoulder joint is incredibly mobile, which is great for allowing it to be functional during a wide range of activities, but that also makes it prone to instability. Obviously, wipeouts increase the likelihood of a shoulder dislocation, but interestingly enough, only 3 to 5% of a surfer's time is spent riding waves. 50% is spent paddling, and 45% remaining still, holding onto their board in rough waters, both of which still put significant stress on the shoulders as they fight against the force of the waves.
And I was on the back of my boat pushing it, and then I'd swim towards it. When I was swimming towards it, I went underwater, went to go swoosh like that, my arm popped out of place.
Have you had your shoulder dislocate before?
Both of them several times.
Shoulder dislocations usually happen when the arm is forced backwards or twisted in an awkward direction. This causes the head of the humerus, or the upper arm bone, to pop out of the glenoid cavity, the socket in the shoulder blade. Shout out to the trainer at Empower Physiology for demonstrating how a wonky paddle stroke like this can lead to some serious issues.
I'm going to dump my shoulder forward, I'm going to rotate through like this, and that's going to put a huge amount of pressure through the front of the shoulder.
One study found that shoulders are the most common area for injury in surfing, with dislocations being the most frequent type. Although the exact statistics vary across studies, this makes sense since surfing is very shoulder intensive. If a shoulder dislocation isn't treated the right way, it can happen again and again and again. Each time it happens, the ligaments in and the capsule around the shoulder get stretched, making the joint weaker, more loose, and more likely to dislocate again. In fact, studies show us that if you are less than 30 years of age, active, and have had at least one dislocation event, there is a high likelihood of recurrent dislocation events if you have not yet had shoulder stabilization surgery and you continue to be active in sports. And I'm sure we've all seen it on TV, people just popping shoulders back in and voila, healed.
If you can do like a J motion,
you're gonna kind of like roll it.
Wait,
Don't
almost
pull
like
like hard, just pull. There.
Oh.
Yeah.
But in cases where the shoulder dislocates repeatedly, or where the humeral head actually has torn part of the labrum, the cartilage that helps stabilize the joint, a Bankart repair is often necessary to reattach it. And in some cases where there is bone loss associated with the labral injury, more constraining surgeries like a Latarjet bone transplanting procedure may also be required. After surgery, strengthening the rotator cuff muscles is key to preventing future dislocations. Here's surf strength coach Chris Mills showing some helpful exercises.
Just an external rotation. Lightweight, higher repetition. At least, I'd say, 14 repetitions.
And if you haven't had a shoulder dislocation yet, focus on stretching the internal rotators of the rotator cuff, strengthening the external rotators, and improving movements in your upper back and shoulder blades, and you should be okay. But as the boys from How to Rip explain, sometimes you do everything right to prepare your body for surfing, but sometimes the power of nature is just too strong.
We can do everything right. We can focus on activating our banana properly.
We can do those long strokes. However, once we get in the ocean, it's a totally different story.
Okay, we're gonna move back onto land for our final extreme sporting injury. Mountain biking is a blast, but it can be brutal on the body. One of the most common injuries? If you said collarbone fractures, then you would be right. When bikers take a spill, they often land on their shoulder or on their outstretched arm, causing the clavicle or collarbone to snap. French biker Loïc Bruni is no stranger to this pain.
Even on the road bikes, they just break it all the time. It's just like, and
The collarbone is made up of two clavicles, one on each side of the body. Each clavicle is a long S-shaped bone that connects the arm to the body. They are designed to absorb impact, but it can only take so much.
I guess collarbone is just the most useless bone in your body, you know.
When a biker crashes at high speed, the force is too much for the bone to handle, leading to a fracture. As physiotherapist Maria Mixner explains, many riders have pelvic issues and tight thoracic spines, which force the body into a hunched position, making the collarbone particularly vulnerable during a crash.
Here, humerus comes in front, and now I hit myself. In that position, where is the pressure going in? Collarbone. And then the collarbone makes like...
Exact numbers vary, but it is generally estimated that clavicle fractures account for roughly 1/4 of all injuries in mountain biking. The risk of clavicle fractures increases with the amount of time spent cycling, which may suggest that more experienced riders feeling more confident in their abilities are more likely to attempt riskier routes. These injuries are especially common in downhill biking, where riders are more likely to crash at high speeds. And, well, in most cases, the fracture can heal on its own with the help of a sling. But for more severe breaks, surgery is necessary to realign the bone and secure it with a plate and screws. Recovery can take 6 to 12 weeks, which is actually relatively short compared to some of the other injuries we've discussed at the beginning of this video.
Because we don't have any articulations, it's just here. Once it's all strong, you can just go back without having to do all the knee rehab or shoulder rehab, you know, so.
Recovery times vary based on factors like the type of tissue involved, the degree of damage, and the body's healing capacity. Bones generally heal faster than soft tissues like ligaments because they have a better blood supply. When a bone fractures, a callus forms around the break and gradually turns into new bone, supported by blood flow. The clavicle, being a small superficial bone with generally good blood supply, heals quicker. Clavicle fractures are also simpler to heal since they don't involve joints or bear much weight. While wrist fractures can technically heal in 6 to 8 weeks as well, full recovery can be slower due to the need for rehab to restore movement and strength. Similarly, an ACL tear, which severely impacts knee stability, requires extensive rehabilitation, lengthening the recovery process. So are all these extreme sports worth the risk? I don't know. You tell me. Do you do any of these sports? Be sure to let me know in the comment section. We've seen how extreme sports can lead to some gnarly injuries, but let's break it down. On the plus side, extreme sports can improve physical fitness, mental resilience, and confidence. They teach you how to manage fear, make split-second decisions, and adapt to unpredictable situations. For many athletes, the rewards absolutely outweigh the risks.
Watching a first-time skydiver jump out of an airplane, and you can just see that joy in their face and that fear and that everything coming together, and realizing what life is about, that life is about living and not just surviving.
On the flip side, however, the potential for severe injury is always there. Broken bones, torn ligaments, and even life-threatening injuries are part of the game. But with the right training, gear, and safety measures, you can reduce these risks. And while society glorifies risk-taking in these sports, it's important to balance that with a focus on safety and responsibility and know when to ease off the gas. The adrenaline rush is real, but so too are the risks. As base jumper Julien Belay says,
as you get more experienced, your decision-making becomes more critical, more influenced by your experience, because you're no longer complacent. You understand what the repercussions of pushing too hard in non-favorable conditions can lead to.
In the end, it's about pushing your limits while making sure you take care of your body at the same time. Stay safe and take care. You gotta be alive and in one piece to enjoy the ride. If you learned anything in this video, then all I would ask is that you leave a comment and give it a big thumbs up to feed the algorithm. This will help us to grow the channel so that we can create more engaging videos in the future. We're working towards our goal of 1 million subs, and we would love to have you as part of the intern army when we get there. Also, don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.